Hello, and thank you for participating in this health promotion topic on dehydration in older adults. My name is Lindsay, and my goal is to provide education on dehydration and how to avoid this potentially deadly condition that will essentially help this fast-growing population of people over 65. What is dehydration? Dehydration is a condition where the body is losing more water than taking in. It is also caused by not drinking enough water of daily water requirements. Water is the most important nutrient needed to sustain life. It is needed for proper utility of circulation, temperature, metabolism, and waste removal. This is important to you because, as stated earlier, aging is inevitable, but it doesn't mean that you have to slow down. You're all very busy people. It's hard and overwhelming to drink the recommended amount of water per day. That is why we're here to establish a routine so that you do not have to think about it. Learning objectives. At the end of this presentation, you will be able to verbalize 3 signs of dehydration, acknowledge risk factors for dehydration, and state what conditions are concerning where you should have to contact your provider. There are many risk factors for dehydration. Decreased kidney function is inevitable in aging adults. Kidney function peaks around the age of 30 and decreases by 10% every decade. So by the time a person is 70, their kidney function only functions at 60% in comparison to the 100% at age 30. Due to this, the body is less able to maintain adequate hydration as years prior. The body experiences a natural reduction in thirst response over time. As we age, our total body water percentage, which is normally at 60 to 70% water, can reduce to around 40% due to the change in the relationship of fat to muscle mass. These are all natural occurrences in the aging body, so that is why you need to be aware of the importance of hydration. Fear of incontinence is also a common fear amongst aging adults. If you have a weight loss of 1 to 2% in a few days, 1 to 2 days, this could be the beginning of dehydration. You do not want to exceed more than 1 to 2% loss of body weight in 1 to 2 days because this could cause delirium and mental problems. Potential complications of dehydration include falls and fractures, heart disease, confusion, delirium, heat stress, constipation, kidney failure, pressure ulcers, poor wound healing, infections, seizures, drug toxicity, suboptimal rehabilitation outcomes, and overall reduced quality of life. This is a list of common signs of dehydration. It is harder to notice these signs in older adults, so it is important to keep a keen eye on these signs. Dry skin, cracked lips, dizziness, constipation, and concentrated urine are signs that you will want to especially be aware of. If at any time you notice these, immediately drink a glass of water and weigh the outcomes. Here is a chart showing normal urine colors and concentrated urine colors. You will notice that at the top color of urine is straw colored. This is what well-hydrated urine should look like. The last 2 dark colors signify dehydration and can cause problems very quickly. If you drink water and do not notice a change in urine color, contact your provider immediately. Here's a review question. What urine color observed should you notify the provider for possible dehydration? A, B, C, or D? The answer is D. This is a very dark, concentrated color of urine. This is concerning, and you should have and you could have other medical reasons for it being this color, so notify your provider. Key points to take from this presentation are to know signs of dehydration such as dry skin, cracked lips, dizziness, constipation, and concentrated urine. This will help you be aware of potential complications. Knowing risk factors like decreased kidney function, reduced thirst response, decline in total body water, and fear of incontinence help in this understanding. The last key point to knowing is when to call the provider. Losing 1 to 2% of body weight could cause significant damage on the body and the brain. Losing more than this in 1 to 2 days could be very deadly. Keeping track of weight daily, preferably in the morning and on the same scale, will help monitor signs of dehydration. Review question. Which is not a sign of dehydration? A, dry skin, B, dry mouth, C, straw-colored urine, or D, dizziness? The answer is C, straw-colored urine. This light yellow color is what your urine should look like, and it shows that you are well hydrated. Another review question. When would you need to contact the provider to report dehydration? A, a 2% total body weight loss in 2 days. B, urine is observed as straw-colored. C, sclera is observed as white. Or D, heart rate is at 60 beats per minute. The answer is A, a 2% total of body weight loss in 2 days. So if you weigh 100 pounds and you lose 2% of that, that equals 2 pounds. This is, if you are at a 2-pound loss in 1 to 2 days, it is very important that your provider knows. What can you do? Some tips to help you avoid dehydration are to drink a glass of water right away in the morning. You can also choose drinks such as fruit and vegetable juice, milk, and water. Fruit and vegetables contain 90% water, so this is an easy variety to change from just drinking straight water. Make note that milk may cause constipation, so keep an eye out for that. Water should be at least half of the fluids you drink per day. Some caffeinated drinks are okay. Just know that caffeine can cause water loss, and the same goes for alcohol. Limit your consumption of caffeinated drinks and alcohol daily. Here is a chart showing how much water you should consume daily. Make sure that you talk to your provider, but essentially, to put it simply, 1 glass of water should be consumed for every 20 pounds of body weight. So if you weigh 120 pounds, you should be drinking at least 6 240 milliliter glasses of water per day. I repeat, talk to your provider to ensure proper daily water consumption. Another review question. True or false? Decreased kidney function is a normal part of aging. The answer is true. Remember, the kidney function reduces by 10% every 10 years after the age of 30, where it peaks. The next 2 slides show the references for this presentation. Do you have any questions? That ends this presentation on dehydration in older adults. I hope it was helpful, and thank you for listening.